This video is about the 5 most important antenatal vitamins that all pregnant women should have. Hi, Dr. Katie, right here on Hey Doc. Thank you for watching and remember to subscribe. Why am I doing this video? I did a post on TikTok about the do's and don'ts in early pregnancy. And one of the do's was, to start folic acid early. I was then bombarded by women asking me whether or not they were on the right antenatal vitamins, how much of it they should be taking, all sorts of questions. And so it dawned on me what I seem to take for granted and assumed most women would know about should be the topic of my next video. So here we are. The first one I'm going to talk about is obviously folic acid. If your doctor tells you about no other antenatal vitamin that you should be on, he or she must tell you about folic acid. Just for you to realize the importance of your doctor actually telling you about folic acid. Some years ago, there was a young lady that had spina bifida, which is a condition that happens as a result of the pregnant mother not having enough folic acid. The child that ended up being born several years down the line sued the doctor that was looking after her mother during pregnancy for not telling her mother that it was important for her to be on folic acid. Why? Because she ended up with neural tube defect that impacted her for the rest of her life. So it is very important. So just in case your doctor has missed that very important information, I am here to tell you. Folic acid is of absolute paramount. There should be no compromise on all pregnant women being on folic acid. The reason why folic acid is absolutely crucial is because it plays a significant role in DNA synthesis, in the repair of DNA. It's also important and needed in the rapid cell growth and cell division that occurs during the early stages of pregnancy, when the organs and the tissues are developing. A little bit more about neural tube defect, which I mentioned earlier. Folic acid is important in preventing neural tube defect and anencephaly. In these two serious conditions, the baby's brain and spinal cords do not develop properly. The neural tube, which eventually goes on to form the spinal cord, develops very early on in a pregnancy, usually in the first 3 to 4 weeks. And as most of you will be aware, you don't even know that you're pregnant at that stage. Therefore, all women in their reproductive years who are wanting to get pregnant should already be on folic acid even before they fall pregnant. Other birth defects that happen as a result of an inadequate level of folic acid in the pregnant mother include cleft lip, cleft palate, as well as certain heart defects. So for women who have no relevant past medical history, who are normally fit and well, are not on any significant or relevant medication, their dosing should be 400 micrograms daily for the first 12 weeks of the pregnancy. So I get all sorts of questions, particularly to do with brands of antenatal vitamins. Look, I'm not going to know the content of each and every single brand. What you must ensure when you go and get your antenatal vitamin from the pharmacy is that the brand that you're taking contains an equivalent of 400 micrograms of folic acid. If it doesn't, and you are hell-bent on getting that specific brand of antenatal vitamin, you also will need to purchase a separate pack of folic acid, 400 micrograms. And in most countries, you do not need a prescription for that. But if you can only afford just the one and you want it to be a multivitamin, only purchase the one that contains 400 micrograms of folic acid. Now, if you have other conditions like endocrine conditions, for example, diabetes, thyroid disease, rheumatoid arthritis, also inflammatory conditions, and you are on medications that you cannot afford not to be on just because your condition will get worse. Remember, you have to be well in order to have a successful pregnancy and eventually deliver a healthy baby. Your dosing of folic acid will be different. You will need 5 milligrams of folic acid daily. Now, whether you should just be taking it for the first 12 weeks of your pregnancy or you need to continue with that dosing throughout your pregnancy will be a matter for you to discuss with your own doctor because clinical situations will vary. Moving on, we have vitamin D. In fact, did you know that having low levels of vitamin D can result in infertility? Watch this space for a video on our social media platforms about the correlation between low vitamin D and infertility. But as we are talking about important vitamins to have during your antenatal journey, let's remain focused. Vitamin D helps to regulate calcium and phosphate in the body. And these two elements are important for the baby's bones and for the teeth to develop properly. Ladies, did you know that without enough vitamin D, your baby is at risk of developing rickets after birth? Its benefits are not just limited to bone and teeth development, but it is also essential in ensuring that your baby has a healthy immune system, whilst helping the mother's immune system to function properly during the pregnancy also. Ladies, did you know that having an adequate level of vitamin D during your pregnancy reduces your risk of developing infections, as well as developing inflammatory conditions also? Some studies have shown that the mother having low vitamin D levels is associated with the risk of your baby being born with a low birth weight. The main source of vitamin D is through having an adequate amount of sunlight shining on the skin. Also, your diet can be a source of your vitamin D, and it's mainly obtained from fortified foods, from fatty fish and eggs. However, those two main sources of vitamin D is often not enough. Therefore, most people need supplementation, particularly in pregnancy, in order to have enough vitamin D. Now, unlike folic acid, where it's a standard dose for all pregnant women, with vitamin D, the levels will vary depending on the deficiency in that individual. But suffice to say that if a pregnant woman sticks to having a minimum of 400 units per tablet, which she will take daily throughout her pregnancy, that is more than enough. That's assuming that her levels are not excessively low. Now, the dose of vitamin D in non-pregnant individuals is normally 1,000 units per day for a 6 to 8 weeks period. Because remember, it is possible to have an excess amount of vitamin D, which will lead to your body having a higher level of calcium, and that could cause various complications like constipation and various other unpleasant symptoms. So if you are a pregnant woman who's been told that you are very, very deficient in your vitamin D levels, your doctor might decide for you to go on 1,000 units a day for maybe a 6-week period. And then after those 6 weeks, you should then be dropped back down to 400 units daily for the rest of your pregnancy, so that you don't end up with too high levels of vitamin D. Omega-3. Omega-3 is a fatty acid, and it is essential in the development of the brain and the eyes of your baby, as well as in the development of the nervous system as a whole. There's a specific component in omega-3 fatty acid, which is known as DHA, which is essential for the healthy development of the retina, which is found at the back of the eye. And without omega-3, the retina will not develop properly, and your baby may be born with a poor eyesight. As a pregnant woman, where do you get your omega-3 from? Two sources: dietary and supplements. Let's look at dietary first. The main dietary source for omega-3 fatty acid are fatty fish. And these fatty fish include salmon, sardines, and mackerel. Other dietary sources are plant-based. We have flaxseed, chia seed, and walnuts. Now, these plant-based sources do not contain the raw omega-3. What happens is that they contain a substance known as ALA, which with a complex reaction that happens in the body then is converted to the omega-3 element known as DHA. And for that reason, many have argued that the best source of omega-3 is from the fatty fish as well as the supplements. Now, the exact recommendation again will vary depending on the individual's health, but having an omega-3 dose of 300 to 500 milligrams every day throughout your pregnancy is more than enough. I did have one of my followers on TikTok ask me, is 1,000 milligram of omega-3 okay? She was a little bit worried that it was excessive, and she was advised to take that amount by her doctor. And she was asking me if it was okay. I don't think there's anything wrong with 1,000 milligram. I don't necessarily think that that's a wrong advice, but what I will say is that this is a dose that is higher than what I would tend to recommend for my patients. I would say sticking to about 500 milligram daily is enough. Very few are the pregnant women who have not heard of iron as an essential supplement that is needed during their pregnancy. During pregnancy, a woman's blood volume increases by as much as 50%. Iron is a key component of hemoglobin, and hemoglobin is a protein that is found within the blood responsible for carrying oxygen to the different parts of the body. Having an adequate amount of iron ensures that both the mother as well as the baby receive the oxygen that they need in order to meet their metabolic need. Pregnant women are at a higher risk of developing iron deficiency anemia. So that essentially means because they don't have enough iron to be part of the hemoglobin molecule, and as a result, they don't have enough circulating blood volume for themselves and for their baby. And pregnant women who develop iron deficiency anemia will describe having symptoms like feeling tired all the time, shortness of breath, feeling dizzy, also experiencing palpitations. So they feel that their heart is pounding through their chest rather fast. The risk of iron deficiency anemia is that it's likely to lead to a preterm birth, a low birth weight, as well as cause serious complications to the mother during delivery. And women with severe iron deficiency anemia tend to have to deliver their baby through an elective cesarean section. There are two main dietary sources of iron: animal sources and plant-based sources. Red meat, poultry, fish, and egg are an excellent source of iron, and the iron from these sources are absorbed much more easily by the body. And for the plant-based sources, we have leafy greens, we've got beans, we've got lentils, we've got fortified cereals, as well as tofu. If you combine the dietary sources of iron as well as dietary sources of vitamin C, like oranges and strawberries, you will improve your absorption of iron. Now, one key piece of information that a lot of people are not aware of, including doctors, is that it is better to advise a pregnant woman to take iron every other day. Why? Because it improves the absorption of the iron from the gut. Now, if despite having a very good dietary source of iron, you are still struggling to have enough iron for both you and your baby during your pregnancy, you need to take supplements. During your pregnancy, particularly if you've been told that your iron levels are low early on in your pregnancy, you need to have a minimum of 27 milligrams of iron every other day. Now, what does that mean? There are tons of different brands of iron over the counter, and you will feel so confused when you go to the pharmacy. But what you need to do when you are looking into purchasing iron from your pharmacy is go to your pharmacist and essentially say to your pharmacist that you want to have a minimum of 27 milligram of iron per tablet. And it will then be up to your pharmacist to work out which brand will best suit you. Also, for you ladies who, despite taking iron, you still struggle to absorb enough iron because you go for your blood test, and even though you've taken your tablets, you're still told that your iron level is low, you may want to consider taking an iron tablet that contains both a combination of the iron itself and vitamin C, because remember, vitamin C is going to improve your absorption of the iron. Now, a key piece of information is that it is preferable for pregnant women to take their iron every other day, because together with the vitamin C, taking your iron this way improves your gut's ability to absorb the iron. It is also preferable to take iron 1 hour before meals. And if you are on levothyroxine, meaning you have problems with your thyroid being underactive and you are on levothyroxine, you must take your iron 2 hours before or 2 hours after taking levothyroxine. Finally, vitamin C is one of the vitamins that I would argue is essential during your antenatal journey. And vitamin C, as well as boosting your immune system for you as the mum, it will also help strengthen the immune system for your baby. And as we have previously mentioned, vitamin C will improve your absorption of your iron, whether you take it through supplements or through your dietary source. Vitamin C is also an excellent antioxidant, and it also has been shown to have anti-inflammatory properties to protect and support your reproductive system. And your reproductive system will definitely need that support during your antenatal journey. Other dietary sources of vitamin D include broccoli, kiwi, and tomatoes, as well as oranges and strawberries, which I had previously mentioned. How much vitamin C should you take? 85 milligrams per day is enough. That's it, ladies, for this video. Now, having gone through this video and you know of the 5 essential vitamins that you need, or elements that you need during your pregnancy, it will help you to choose the best antenatal vitamin based on the minimum and maximum doses that I have described in this video. I hope it's been helpful, and as always, I look forward to seeing you in our next video. Check out some of the new stuff that we've got going on this channel to do with pregnancy, as well as our most loved fertility medicine and women's health. Before you leave, remember to show us some love, like our videos, share, and do not leave without smashing that subscribe button. Take care, and we will see you later.